Hi, my name is Jordan, and today I am going to demonstrate how to give an IV push med through a central line, more specifically a PICC line today. So, first thing we're going to do, we are going to check our order. We see that Jennifer Doe, we went in and did a pain assessment on Miss Doe. She is at an 8 out of 10. We did a full pain assessment, and she does have morphine prescribed that we can give her PRN, IV push every 3 hours, which she has not had any today. And we are giving this through a PICC because she pulled out her peripheral line this morning when she was getting out of bed. So we have not gotten a chance to get her a new one. So we're just going to give it through here before getting her a new one. All right, so I have gathered my supplies here. I have 3 10 milliliter saline flushes, all not expired. I have a drug here that is also not expired, morphine sulfate, which is 10 milligrams per 2 milliliters. I have a vial access device, some alcohol prep pads, some paper tape, which I have pulled a piece off for our label, some hand sanitizer for hand washing. I have my math, Betty book, drug book, and some clean gloves. All right, so we know that Ms. Doe needs this morphine. We have assessed the need for it, and we do think we are going to give it here. So, first thing I'm going to do is I am going to take a look at my med to make sure that I did pull the right med off the PICC, and I have morphine, 10 milligrams per 2 milliliters. And we do have morphine here, 7 milligrams IV push every 3 hours. So we are going to give that. All right, so we're going to wash our hands. Okay. And our med is not in a vial, so we are going to have to waste this med. And in order to do that, I am going to have a second nurse first check my math.
That looks accurate.
Perfect. And as you see on the bottom here, I do have the rate and the dilution, which I did find in the drug book. And that is easily found. If you go in the morphine, in the administration, it says when giving direct IV, dilute in at least 5 milliliters of solution or normal saline. And also to give 2.5 to 10 milligrams, which we have 7, over 4 to 5 minutes. And we note that some side effects here. That is a respiratory depressant, this is CNS depressant, and an opioid analgesic, so a lot of nausea and vomiting that can come from that. Keeping that in mind moving forward, I will grab Mal and we will waste our medication. And sometimes you got to check your agency policy. Some will do it in a trash can. Others have a black box or something similar to dispense the unused narcotics in. And we will get dose accurate. Okay. And I will allow for my colleague to take a look.
Looks correct.
Looks correct. The camera got a chance to take a look. So now that we are dose accurate, we are going to do our 3 med checks. So we have morphine sulfate, 7 milligrams, IV push every 3 hours, PRN for Jennifer Doe. We have morphine sulfate, 10 milligrams per 2 milliliters, which equals 1.4 milliliters per dose for Jennifer Doe. Morphine, 7 milligrams, IV push every 3 hours for pain for Jennifer Doe. We have morphine sulfate, 10 milligrams per 2 milliliters, which equals 1.4 milliliters per dose for Jennifer Doe. Morphine sulfate, 7 milligrams IV push every 3 hours, PRN for pain for Jennifer Doe. We have morphine sulfate, 10 milligrams per 2 milliliters, which equals out to 1.4 milliliters for the dose for Jennifer Doe. We note here also that she does not have any allergies, and we will be checking when we head into the room. So we are ready to dilute this medication. We have checked our compatibility in our compatibility book, which morphine is compatible with all of these listed, but we are using normal saline, and it is also compatible. So we will take our IV flush here, sterile IV flush, and get the air bubbles out. And we will dilute this in 5 milliliters. And you can do more, but we don't want to do less. So I'm going to get 5 milliliters. And we are going to give ourselves some room here. Making sure the cap is up so we are sterile. We connect to our VAD. And we put the medication in. Now, this would go into our sharps in most places because a VAD is considered in most facilities a sharp. But in this case, we are holding on to this. So we will put our cover back on after we push the air out, making sure not to waste any med because it would be inaccurate to know how much was wasted. And all the air bubbles are out. And immediately labeling the med with the date, time, our initials, the client's initials, the drug inside, and the dose. We are ready to head inside. All right, so hi, Miss Doe. My name is Jordan. I am the student nurse on the floor today. I hear you're having some pain.
Yes, lots of it.
Lots of pain. Awesome. Well, I'm going to provide for privacy for us here and wash my hands. And while we're doing that, can I get your full name and date of birth?
Jennifer Doe, 11/5/75.
Perfect. Okay, Miss Doe. So today we are going to be administering some morphine to you, and that'll definitely take care of your pain. Have you ever had it before?
No.
No? Okay, so morphine is an opioid analgesic, and it is also a narcotic. So a couple of side effects. Nausea and vomiting is very common, as well as maybe some dizziness, some orthostatic hypotension, and things like that. And you may get like a fuzzy feeling. We hear that quite a bit. So is that okay?
Yes.
Okay. So also this is a CNS suppressant. So I am going to check over your a couple of your vitals. We're going to do a respiratory rate. We're going to check out your lungs, do a cardiovascular assessment, and we are also going to catch your blood pressure on you. How's that sound?
That sounds great.
Perfect. So those assessments we do, and they are all within normal limits. Okay. We are going to now check. I'm going to wash my hands again. I'm going to take a look at the site and just note that there is no redness, edema, ecchymosis, drainage, or and the approximation is appropriate here. There are no signs of infection, infiltration, or phlebitis. So we are okay to use this. It is clamped. We have a cover on it. So I am going to wash hands again and then put my gloves on. And if this were perhaps a small child, we would do our math a little bit differently. We would include weight into our equation, as well as probably we would administer this drug over a longer period of time. So, okay. I am going to first do a saline flush. And I'm going to get the air out here. Okay. All right, you ready, Miss Doe?
I am.
Awesome. Get rid of that pain for you, huh? All right. So I'm going to start by, if there was a cap on here, we would take the alcohol impregnated cap off and wiping for 20 to 30 seconds with our alcohol pad. And allowing that to air dry, we would again make sure that the air is out. Okay. Connecting. And because this is a PICC line, we would be using a pulsating flush to do our first flush. Okay, clamping it, removing, and this can go in the garbage. Now, with our med, I am just going to get a full name and date of birth one more time from you, Miss Doe.
Yeah, Jennifer Doe, 11/5/75.
Awesome, and no allergies, right?
No allergies.
No allergies. I am looking at the MAR, and our dose is correct. We have 7 milligrams here for IV push, diluted in 5 milliliters of normal saline, and I am good to give this med. If I can get the label off my hand. Okay, so again, we are going to wash with alcohol for 20 to 30 seconds and allow that to dry. All right, Miss Doe, I want you to let me know if at any point in time during the administration of this med you begin to feel nauseous, the need to vomit, or you start to feel like you're coming in and out, anything like that. You start to feel like you're having trouble breathing, okay?
Okay.
Awesome. Okay. So we are administering this over 5 minutes. I'm going to note the start time and begin our push. I'm clamping it, of course, beginning our push. And I'm going to speed things up just for the sake of the demonstration. After our 5 minutes is up, making sure to repeatedly check with our patient on how she's tolerating and how are we tolerating this, Ms. Dill?
I am doing great, thank you.
Awesome, I'm sure you are now. We will clamp and wipe with another alcohol pad. 20 to 30 seconds. And we have a post flush. And all the air is out. For the first 30 seconds of this flush, we will be noting the start time and pushing this over the same duration as the medication for at least the first 30 seconds. And again, fast forwarding, after that we will use a pulsating flush technique. And as I had said before, for a child we might push this over a longer duration and a smaller dose. Okay. Clamping and removing. We will make sure that we use an alcohol impregnated cap or another sterile covering if need be. And how are we doing, Ms. Doe?
Still doing good.
Awesome. Okay. So we're going to make sure to, I noted in the drug book that this med does take about 20 minutes to reach peak effect. So I will be checking in on Ms. Doe to make sure that this is reaching a therapeutic, we are reaching a therapeutic drug level. And I will perhaps raise the head of the bed to help with, or the head of the bed would have been raised in order to help Ms. Doe breathe. We're going to lower the bed to make sure, because this can cause orthostatic hypotension and dizziness and things like that. Call light is within reach. We will get rid of our supplies, remove our gloves, wash our hands, and we will unprovide privacy. And we will make sure to document the time, date, assessment findings, as well as the drug administration, the amount, where it was administered, how it was, the reaction, how it was handled, and anything else that goes along with that. And that is how you administer an IV push medication through a central line.